had a rash around my neck, on my chest, and on my legs. 6 years to the day I've been alive, and I probably shouldn't have had the last couple of years, but she made it possible. She's the one that saved my ass.
As a diagnostician of dermatology, I specialize in decoding the mysteries of rare and complex skin conditions. A skin finding may actually be the sign of internal pathology. I'm here to reveal it as your Skintellagent. Tom is a big, gruff, strong guy who gave me a little run for my money at the beginning. You know, he had been dealing with a rash on his skin when he first came in as a patient to me in the office that had been going on for somewhere between 9 and 12 months. He didn't remember.
I told her what the problem was with the rash. I couldn't get rid of it. It made me miserable. She did a lot of tests.
I was frankly aware that I did not know exactly what was going on. I felt confident I was going to get there, and I remember shortly into our visit looking at him and saying, I will stick with you and I will do everything I can to figure this out. I'm going to be clear with you. I don't know what's going on right now.
We tried new things. We tried different drugs. We tried different injections. We tried different creams until one day she figured out what it was.
Necrolytic migratory erythema. The only other case I've ever seen was in a patient I had seen about 12 years ago, a young girl who's 14 years of age, who was quite literally failing to thrive. She had lost a substantial amount of weight. She was weak. She was no longer able to think or concentrate clearly. And the morphology, the shape and size and coloration and distribution of the rash was in some ways quite similar to what I saw in Thomas. And yet, you couldn't have had two more different humans, but manifesting a very similar clinical presentation related to the same internal pathology. Necrolytic migratory erythema is a very classic presentation that exists in the skin with a reflexive, very classic presentation under the microscope. So these two things kind of overlap one another. We call that in medicine the clinico-pathologic correlation. And they come together and they tell you that someone likely has a tumor in their pancreas.
When she told me what she thought it was, after the test I'd had, and she sent me to have tests and blood and x-rays and MRIs and CTs and all that. Once she told me what it was, it scared me. It really did. I mean, when they tell you you have a problem with your pancreas, and I've had several friends die from it.
I was able at that visit to order a CT scan so we could better investigate the anatomy of his pancreas, and there it was. There was a tumor in his pancreas about, yay big, called a glucagonoma. Not the typical type of pancreatic malignancy we think about when we hear about pancreatic cancers, but nonetheless a pancreatic cancer. And these glucagonomas cause the sugar in the blood to stay in the blood rather than to be absorbed by cells. And that causes diabetes. High blood sugar is diabetes. So he had been diagnosed with diabetes and was suffering from the consequences of this tumor in the form of having had chronic diarrhea for about, the better part of a year. And that all was part of this whole constitution of what was actually showing itself on his skin as the window, as the ailment that provided us that window into what was going on. So it was within just a couple of weeks thereafter that Tom was in to meet with the surgeon who took out a very large part of his pancreas. He had to have a couple of subsequent surgeries to bring his anatomy back to functioning, and he's done really well. Full circle, Tom comes into the office and we usually embrace in a big hug, and he says, "You saved my life."
She never gave up. She just kept going and going and going and going. She just wouldn't quit. I was surprised during it, and she kept, where nobody else ever kept like that. They didn't keep going. They'd get to a point and say, well, I'm not sure. Well, let's try this. She didn't do that. She came through. She's the most tenacious person I've ever known in my life, and for a doctor, you couldn't ask for anything better. She's just wonderful. She thought a lot about me and she saved my life. And for that, I'll be eternally grateful. Thank you.